Ready. Okay, so welcome everyone. You're here for a panel discussion on youth mental health and suicide prevention. And the focus of our panel today is Youth Voices, Youth Hope. So let me just first introduce myself. My name is Cheryl Boswell. I'm the Executive Director of Youth Mental Health Canada. We're a grassroots, community-based, youth-led charitable nonprofit organization in Canada that focuses on youth, family, and community engagement for mental health, education, support, advocacy, and change. Um, so the youth that are going to be talking today come from diverse backgrounds. They're going to talk more about their backgrounds. And the youth that are involved in YMHC come from across Canada and internationally as well, including United States, Europe, and India. So um, if you want to know more about YMHC at the end of our presentation, I'm going to share some resources with you. We have free peer support services. We have workshops and a conference coming up, Hope Rising Part 2 on October 2024. So welcome, and I hope that you'll enjoy this panel discussion. So panelists, thank you for joining me today. We're going to do a go around. Could you introduce yourself, please, with your name, your location, your connection to youth mental health and suicide prevention, and any interesting things that you'd like to share about yourself? Emma, could you go?
Hi, so my name is Emma Peterson. I've been volunteering with YMHC since May of this year. I have been the coordinator of the TikTok committee all summer and have just joined the board of directors as the director of community engagement. I have lived experience with multiple mental health conditions, including ADHD, autism, CPTSD, major depressive disorders, and OCD. So yeah, I've lived with that my whole life. Fun facts about me, I'm bilingual, English and French, and I've lived almost in every province of Canada.
Okay, wow. Okay. So, and Isabel, can you introduce yourself, please?
Yes. So my name is Isabel Garcia. I currently living in Springfield, Massachusetts, but originally I was born and raised in the Dominican Republic. I started volunteering for youth mental health a couple of months ago, doing Spanish translations for various promotional materials. And my connection to suicide prevention is that I have lived experience with suicidal intensity and depression and anxiety as well since I was a child. And a fun fact about me is that I love K-pop, South Korean music. And one of my biggest dreams is to travel to South Korea.
Wow, great. Okay, and Tracy.
Hi, my name is Tracy. I am from Ontario. I'm kind of in the GTA area. I kind of go all around there. My connection to youth mental health Canada is I do some of the TikTok videos. I send them in, and Emma works for Magic. I do the Instagram lives in sign language and English. I help work on the slogans and translation committee as well. And I believe that's all that I do. And then my connection to general youth mental health and suicide prevention in Canada is I work with the United Church of Canada Mental Health and Wellness Committee in kind of working to inform people in the faith committee around, in the faith community, sorry, around what mental health and wellness looks like in regards to the faith connection and how to teach those that are preaching about faith and how to connect mental health with our faith communities. And a fun fact about me is that I'm currently completing a double bachelor's degree in honors social work and religion and theology.
Okay, great. Okay, thank you very much, Tracy. And Rachel.
Hi, so I am Rachel. I'm from Calgary, Alberta. My connection to youth mental health is I'm a current practicum student. I just started at the beginning of September, and I'll be doing my placement here until I think the end of April next year. I also have lived experience with mental health personally, and a lot of my family members have been affected. I have been misdiagnosed numerous times, and I've finally narrowed it down to being bipolar, which I am really relieved about. This is probably the happiest I've ever been and the best I've ever felt. So that's been major relief in my life. Fun fact about me, I am very afraid of horses.
Having been on a horse?
No, I really don't like going near them. They're just terrifying. They're ginormous. I just don't. I don't know what it is.
So no Calgary Stampede for you. Okay, so just to give an overview to this, this is a quote from the World Health Organization that I thought was interesting. It says, "It's time that adolescent health comes of age. Adolescent health is a smart investment. Not only will it improve health and survival in the short term, it will bring benefits for future generations." And I have to say that it is time that we show with action, not with legislation that's beautiful language on paper, not with words that say we value young people, but with real action that demonstrates that we care about the lives, the health, the education, the future potential of young people. Because if we don't put the action in place, then we continue to add to the kinds of issues that we're dealing with now, public health crises that are not just about COVID-19, but we have mental health crises that predate COVID-19, mental health and suicide, youth suicides. The rates are increasing, the funding is increasing, but what is happening with the funding? Where is that money being spent? And how is it really making a difference for the lives of young people? We need to put action behind that. And the good news is, if there's good news in this, that despite the youth mental health reality, which is very real, and it touches many people, and in fact, I would say all people in Canada, because directly or indirectly, we all are touched by mental health, and certainly that's very real in COVID during the pandemic, that we all are talking about how we experience mental health and mental wellness challenges. We have more resources than we've ever had before, very true. On social media, there's lots of information, lots of resources, lots of videos on YouTube, lots of, short-term types of programs, stopgap type of measures like walk-in clinics or those kinds of things. We have lots of youth leadership. There's lots of youth mental health advocates in student groups, student associations, or in nonprofit organizations, helping to guide us. So what are we doing with that, that kind of leadership and those kinds of resources? So this panel discussion brings together people from lived experience. There's other people who are part of the panel that hopefully will join us as we continue, because I know the conference platform is posing a real challenge. So we've decided to record this session and upload it so that to YouTube and to the conference platform. So hopefully people are able to access it in various forms. The youth that we have today speaking out about youth mental health and youth suicide prevention come from diverse backgrounds, as you can hear. And we are talking about emerging promising practices to really focus on the kinds of issues that we have and the kind of communities that we want to build. So the first question is, what are the challenges? And these challenges increase risk factors for mental health challenges and for suicide. So we're looking at these questions. So you can, whatever question appeals to you, but they're all somewhat related. What are the challenges? What are the issues we're dealing with in youth mental health and youth suicide prevention? What challenges have you personally experienced? You could talk about some of the biggest challenges that you've experienced. How do challenges in youth mental health and suicide prevention increase the risk factors? So do the opposite of what we're working for, what the funding is meant for, what mental health organizations are there for, what youth leadership is talking about. So by not supporting, providing the kinds of supports, services, and educational accommodations needed, then we increase risk factors. So what are these risk factors that we're talking about? And have you felt supported in schools you have attended? So let's start with Isabel.
Personally, back in the Dominican Republic, I experienced many challenges, and many of them were interpersonal, so with my family. In the Dominican Republic, there's not necessarily a lot of conversations about mental health in general, much less suicide. That is not something you talk about. So while I was growing up, I showed very obvious signs of depression and anxiety, but my parents did not do anything about it. Not necessarily because they didn't care about me, but because they really were ignorant about it. They didn't really have an education about mental health. And so while I could have received early interventions, I didn't because they missed those signs. And with that comes, the cultural stigma. There's a lot of, I experienced a lot of invalidating responses. So back in the Dominican Republic, herbalism is a big coping tool for things like anxiety. We call it ataque de nervios. So you get a lot of invalidating responses like, if you drink this tea, you will feel better, which a lot of teas do work. I'm not saying they don't. It's just that that might not be the first answer you want to hear when you say that you want to die. And in school, there was no counselor in school while I was in Dominican Republic. So I didn't really have a system where I could go to ask for help.
Okay, good points, Isabel. And Tracy.
Yeah, so for me, the challenges are really the stigma, and that kind of, relates into the issues, which is, the lack of education that there's been for a really long time, and especially around, trauma-informed practice was really, really big issue when I was younger, especially, which kind of into, my personal experience, which was I had therapists who were coming from a lens that was not trauma informed, and that really caused more damage because there was a huge lack of understanding there when they weren't coming from this trauma-informed lens. And it actually led to a lot more damage than I had going in the first place. And, it kind of made me feel more guilty about, things that were put upon me as, a child who was in the foster care system. I felt guilty for being there, and like it was my fault for the things that had been done to me in my past. And then I was like, okay, well, what am I supposed to do with all this trauma and all this guilt that I'm feeling now that, you know, I hadn't even thought about before, right? About my past and all this trauma. So I think, you know, that was a really big challenge for me, was, you know, dealing with the lack of education that, you know, my teachers didn't really know the signs for me being, you know, really depressed and having these suicidal ideations and, you know, suicidal tendencies that I was having and not noticing those signs. And then obviously my friends at that time were too young to really understand those signs and symptoms of suicidal ideations and suicidal tendencies too, right? And teachers just didn't have that lens of or education or training around what suicidal tendencies were or what depression symptoms really were, kind of thing, right? So it was just the whole kind of challenges and issues all kind of combined for me when I was growing up in school. So yeah, I think that was a huge risk factor for me growing up, and just a system-wide challenge as well.
Okay, great. Thank you. Emma.
Yeah, I think I would agree with the education. I don't think that, well, I know for myself growing up, I didn't have adults in my life who were educated in mental health. I showed signs of depression and my ADHD and autism since I was like 2 years old. And looking back, it was very evident, but my parents didn't know because I wasn't the stereotypical present. Like my symptoms weren't the stereotypical thing that people are taught in society. Unfortunately, that led to me being diagnosed way later in life than I could have been. And I think there could have been a lot of intervention to help me through that. So I'm 20 and just getting on my feet with coping mechanisms and stuff. And I think that if we really had education society-wise and we were able to educate parents in maybe the signs and symptoms of mental health in general, as well as teachers. I've worked with teachers as an EA for a few years, and this was 2 years ago, and I was still shocked at how little they really knew about mental health in general, which was really it was disappointing. Mm-hmm. So I think education, or lack of just education from a lived experience point of view, is a huge issue and a huge barrier, I think, for a lot of people.
Mm-hmm. Yeah, and I remember you talking about throughout high school, you missed a lot of high school and there were no
most of it
for you, and the difference when you went to post-secondary.
Yeah, it was, I never had any support in high school or elementary.
Mm-hmm. Okay, and Rachel?
I think one of the biggest challenges that specifically affected me was definitely not having support in place in schools and that education of mental health. You know, I remember being in grade 6, I had so much going on around in my life. My mom had been diagnosed with cancer. I had an absent father who I'd still been dealing with abandonment issues and emotional abuse, trauma, and stuff like that. And I remember telling my grade 6 teacher at the time, saying like, I don't want to be here. Like, I don't want to exist. And being that young, I didn't know what that meant. I didn't know that there was a term for that, that there was a specific, you know, language associated with that. And I just knew that I wasn't feeling good. And after I told her that, nothing was done. There was no, you know, phone call home. There was no, you know, reference to the guidance counselor, nothing. And, you know, you'd think if you have a young kid like that coming to you, you advocate for them if they're not able to advocate for themselves. you know, you're at such a young age, you don't know what mental health is or that it exists, that, you know, you can't advocate for yourself. And so I think there definitely needs to be a change in schools, just because, you know, children and youth do spend majority of their time at school. They're, you know, learning different things from their peers and having all these different thoughts put into their head, you know, from children who are going through different things other than what they're going through, and there's no support. And even at home, if you have parents who don't know what mental health is, or in some cases, I know I have friends who parents don't believe in mental health. You know, if you're surrounded by ideologies like that, you know, nothing good is going to come from it.
Good, excellent points. Thank you. So there's a real difference between expecting. So we're told in society, reach out, as if there's something there when you reach out. And so we have these kinds of expectations, and we should have these expectations that our needs, our concerns, our health matters. You matter. We say that. You matter. And young people's lives matter. But the reality is very different. And we're starting to hear that, you know, just as the challenges you addressed are looking at some of those very real experiences that young people and their families experience. So what do you feel is the biggest disappointment in youth mental health and suicide prevention? Have you felt let down by societal systems, by whether they're education, health, or mental health, or by attitudes and actions that people have taken to discriminate against you and your family? And what do you feel are the biggest gaps in youth mental health and suicide prevention? Rachel.
I think one of the biggest disappointments from my point of view is, you know, having a teen or a youth expressing how they're feeling. You know, they're showing signs of depression, anxiety, or mood disorders, and, you know, you just slap the label on it and medicate them rather than working towards the root of the problem. What is causing this depression? What is causing this anxiety? You know, medication works best in combination with therapy. You know, so for some people, just therapy works, just medication works. But if you're just medicating somebody without working towards the root of the problem, then it's still going to persist. That's still going to be a really big impact on their life if it's not being dealt with.
Yeah.
And a way that I've been let down, this wasn't necessarily when I was younger, but just in an old practicum that I did, I wanted to, you know, I was in a high school and I wanted to make an educative board for students to look at, to, you know, learn about mental health in a healthy way rather than learning about it on social media. And I was told by my supervisor at the time that they didn't want any ideas being planted in students' head. And that right there, I think, is a very dangerous way of thinking. Just because if you're not giving them, you know, facts, you're not giving them informative information, they're going to learn false information elsewhere. And that's going to really have a negative impact on them rather than, you know, learning from school, especially.
Yeah, and the expectation is that education, the education system, is the place to respect the brain and to talk about
Exactly.
and brain needs and brain differences and learning differences. And if that's not the place to talk about health and life and learning and respect, where is it? You know, because there's so many taboos, and to reinforce those taboos about mental health or suicide is such an unhealthy way of reacting and not really being proactive about this is a reality, right? Emma, I know you've had a lot of experiences with this question.
Yeah, it's kind of one of those questions where it's like, well, what system are we talking about? When it comes to the education system, the obvious gap to me is lack of supports. To me, the devastating lack of supports, especially in Alberta, it's been cut down this year. To me, that just feels like as someone with ADHD and autism, which already impacts my learning on top of my other conditions. It feels like they're telling me that my education or like isn't as important, which is really disappointing because I know there's tons of people who also feel the same, where it's like, I don't deserve support. Like it just, they claim it's equal education, but it's not. If there's no supports, you're not giving a kid who's struggling the same opportunity as a kid who's not. And then when it comes to like the medical system, I do think there's almost an over clinicalization, I don't know if that's a word, but of mental health. There really is a lack of education and through someone with lived experience. I know for myself, I was in a ATV accident last year, I think it was, and I had bruised some of my internal organs, but a few weeks later, I had went into the ER because I had like huge pains in my stomach, like it was really bad. And I figured something was wrong. And they let me sit there for 7 hours. I never saw a nurse. I never saw a doctor. They just put me in a room. Then 7 hours later, the doctor comes in and says, "We don't see anything wrong with you. You're good to go." But the thing is, 5 minutes earlier, I can hear everything. I have a very hypersensitivity to sound. They didn't know that. Him and his buddy in the hallway he was also a doctor. They were looking through the chart and he's like, "What do you think's wrong with her?" And he looks at him and he's like, "Look, psychiatric." And then they start laughing, and then he comes in and tells me that there's nothing wrong with me.
Wow.
So there is this stigma, especially when it comes to going into the ER. Like, I am someone who doesn't go to the doctor now unless I know something needs to be checked out. Because there is that fear. There's been many times where I've just been sent away. Never mind when it comes to trying to get into a psychiatrist or a psychologist, the wait lists. It's like, we'll see you in 12 to 18 months when you're in a crisis. And it's devastating, really.
And Tracy, any experience with disappointments?
Oh yeah, for sure. So I have a seizure disorder. I have a really rare seizure disorder. But it took me 11 years to get diagnosed because I went through about, I want to say, 7 different doctors and neurologists because I was seeing kind of like Emma as a mental health case because I was a child who was in foster care and I had a lot of trauma in my past, and because of the trauma in my past, everyone was just saying that I was either faking my seizures or they were pseudo-affective seizures, basically meaning that they were seizures that were caused by a mental health issue. So if I was just medicated enough on some kind of mental health medication, that they would go away. So I was drugged to the nines on all different sorts of antidepressants and antipsychotics, but I was still suffering from 2 to 3 seizures a day, and these were full body seizures that would last anywhere from 5 to 10 minutes. And I was just getting tossed around from neurologist to neurologist and psychiatrist to psychiatrist, and I was like, something is wrong with me. I'm not faking it. There's something else wrong. Yes, I'm depressed, and yes, I have PTSD and trauma, but there is something else. So that for me was like a huge letdown for so long until I had a neurologist that finally believed me and was like, okay, something's wrong. But, I think that there's that, gap between seeing that patients also have, they can have a mental health concern as well as a medical concern, right? And that needs to be taken seriously as well. And educating more people around the fact that it can be one and another as well. And teaching mental health in schools, right? Not only to teachers, but to children as well. And teaching them, to respect others that may be challenging, right? So if a child happens to cry in class, that's not a strange thing. Or if a child that has autism has, a breakdown in class, or has a fit or something that happens, it's not seen as this huge deal. It's just dealt with. And kids learn to, kind of almost normalize that situation. And they're like, okay, John's having, issue right now. We're gonna, let him or her or them deal with their issue, and we're gonna continue on class over here for right now, right? And just carry on instead of kids being like, oh my gosh, that person is, going crazy, right? Because that's not normal to say those kind of things, and that's not normal to react in that kind of way, when in reality that's their normal. That's their reality that they have to live with every single day.
Okay.
Right. So learning to kind of incorporate these things into our normal so that people don't feel ostracized from our community and our society when they have these challenges in mental health.
Okay, I'm going to keep moving us along because I just want to make sure that we're able to upload this to the platform for 6. So Isabel, so the last question is if you can sort of touch on the biggest gaps, and then some of what's worked for you, or how have you felt supported, and what changes could we make so young people feel more supported?
So in terms of the second questions for biggest gaps, in the US, there's a lack of representation when it comes to race and ethnic background. So youth of color cannot really find someone that looks like them in mental health staff. And there's a lot of involuntary hospitalization for youth, meaning that once they say they want to die, the first thing that a social worker might do is call 911 and not really have a conversation. In terms of what has worked for me, educating my parents about science, about what I need, has worked tremendously for me, because now I feel validated. And also empathy from professors has helped a lot in terms of having extensions for assignments and things like that, because they understand what I'm going through. That has definitely helped.
And I know in the past you've talked about the importance of multilingual information, that we can't just keep presenting information in English. And that's one of the reasons you started working with Youth Mental Health Canada, because we're looking at, really addressing cultural reality, cultural stigma, and being a lot more culturally sensitive in how we do what we do. So yeah, so I'm excited that you joined us for that reason, and that we're really becoming a lot more accessible, not just through our print resources or social media, but also through Insta Live chats as well. So Tracy.
For me, what really worked was going to workshops on mental health awareness and suicide prevention, which was a huge changing point for me in learning how to help not only myself in coping, but learning how to help my friends and others. I think that all of those kind of workshops, whether they be free or ones you have to pay for, they were really important for me in learning how to deal with everything that was going on.
Great. And Emma?
I think one of the things that has really helped me the most has been, like, from a very young age, I realized there was no supports and no one else was gonna like really explain this to me. It seems like they always introduce it in a clinical way. They don't really, you don't really get the like, so this is like our life, like, welcome. We don't get that. We get like, here's the possible medications, here's your main symptoms, have fun. And so for me, that wasn't enough. So I really, from a very young age, dug into research and just learning about my conditions and what that really means about how I interact in the world, how my brain functions maybe differently than most people's, especially from neurotypical brains. Because the more I understood about myself, the less I blamed myself. And I realized, oh, that's not my fault. Or I'm just different, I'm not wrong. Because when kids go undiagnosed for so long, we don't introduce this to kids. We don't say, okay, some people have a different setup in their brain. It doesn't mean it's less, it's just different. But we're not taught that. So when you're a kid and you've never learned about mental health and you've never learned about that stuff, you think you're wrong. You think you're less. You don't think you're different. Especially if no one knows.
Yeah, and we talk so often about the importance of being validated, being heard, given space, you know, and all those things. And, you know, exactly what you're talking about. If you don't provide those opportunities, what happens? Then you increase the risk factors for mental health challenges and, you know, all kinds of other kinds of issues that relate to that.
Because for me, because I was diagnosed so late, I was raised as if I was neurotypical. But I'm not. And that can do a lot of damage.
Okay, and Rachel?
The biggest thing that worked for me was learning how to advocate for myself. In grade 12, when I was pretty much at the peak of my worst possible self, my mom was actually the first person to realize that my daughter is not okay. She needs help. She's not in a state of mind where she's able to do that. And so she ended up talking with my family doctor and bringing me in. And, you know, after sitting down with him, my psychologist, we all realized, like, hey, she really needs some help right now. And after that, I was hospitalized for 2 weeks, which was, it's a terrifying experience. But that exposure, that kind of immediate course of action really helped. And from there, I've been able to really learn how to, you know, reach out when I'm, you know, having some lows, reach out when, you know, I just need someone to talk to, and really recognize when I do have days where I don't feel like myself, or I have days where I feel great. You know, it's really about recognizing progress, I think, too. You know, looked at where you were and where you are now. And then support, yeah, like I said, just my mom has been the biggest support in my life.
Yeah, I wish more systems understood that family engagement is a critical piece, because most often it's the mother advocate that's making the change and, you know, paving the way. You know, all the changes that we've you know, made systemically or societally, really it's often mother advocates behind the scenes doing that work. So if we recognize that and really start to create those kind of support teams, it could make a huge difference. Some changes in youth mental health and suicide. So this is a general question. It gets at the next one. You know, what are the trends you're seeing? A lot of the media is covering issues about, you know, younger people are, you know, I don't think there's a change in age. I just think that this is becoming discussed. You know, that, you know, throughout history, there's been young people who felt suicidal, talked about it, made attempts, but we haven't recognized, we haven't created space for people to talk about it. You know, often we are fearful of people with mental health disabilities. So you know, the reaction is to reject, to exclude, to isolate, to discriminate against people. Do you think youth mental health issues are increasing? Is COVID making a difference for young people? And why, or do you think we're just talking about it more? What changes do you see in your own community? And if we can just keep the conversation, like each chat, to about, you know, 1 or 2 minutes, that would be great. So Rachel, any comments?
I think one of the reasons we're seeing an increase in mental health issues, specifically in this day and age, is because we know more about it. Mm-hmm. We each year learn more and more symptoms and signs and how to help. And whereas, you know, way back when, like, they didn't know anything. You know, if you had mood disorder, you know, you were crazy. There was no label for it other than you are crazy. Mm-hmm. And so I think a big reason, like I said, we're seeing an increase is because we know more, we're more educated, and you know, we know how to help. We just need more push for help to be put in place.
Mm-hmm. Okay, and Emma?
I would definitely agree with everything Rachel said. I think it is being more talked about, and I think we're seeing it mostly in youth, maybe generation-wise, has a big impact. I know even talking to people 1 or 2 generations before me, there's a huge difference in how they talk about it. And so I'm 20, so I'm kind of right where youth is right now. And I think our generations have really opened up about it a lot. And I think going forward, that is going to be more so, I hope.
And Tracy?
Yeah, I think it is kind of increasing, but I also think that, you know, social media plays a huge role on mental health. And, you know, the younger generations now, they're growing up with social media, and there's that huge pressure to look a certain way on social media and to have certain things when you're posting on social media, and to have a certain lifestyle that me growing up, even being 25, I didn't have that pressure until I got to, you know, early high school, late middle school. So, you know, there's a different pressure on youth nowadays, and you can see, you know, the suicide rate, you know, increase as the years go on, and the younger people are getting, you know, social media so much younger. So, you know, there is a lot of pressure for teens and preteens nowadays, but it also goes along with, you know, yes, we are talking about mental health more nowadays, but that's a good thing too, right? So
Mm-hmm.
kind of goes hand in hand. Like, yes, we are seeing youth being more impacted by mental health, but we are also shining a light on mental health conversations, because youth aren't as afraid to talk about it and say, look, I'm struggling, or my friend is struggling, and say, I want a conversation to happen because I don't want my friend to die by substance abuse or die by suicide. So have a conversation.
Okay.
If I want to.
All right. And Isabel, so we're going to slide into number 5 question. Hi, Michael. Introduce yourself. So we're pre-recording this because there's a lot of issues with the conference platform. So we're almost finished. So if you want to introduce yourself, and I'll let you talk about what progress you think we've made in mental health and suicide prevention. So
Sure.
Who are you? Where do you come from? What's your background? What do you
Yep. So my name's Michael. I'm currently a recruiter right now for accounting professionals. I live in Toronto, and yeah, I've been quite involved with mental health, wellness, during university and whatnot. So I'm glad to be here.
Okay, and for you, with somebody with lived experience, what kind of progress do you think we're making, or what kind of challenges have you experienced?
I think there's certainly a lot more awareness in the mainstream these days. Previously, mental health was something that was really kind of a taboo. Nobody really, it was like the elephant in the room where people had a lot of difficulty even broaching the subject. But these days, it's pretty, the message is out there that mental wellness is an important part of just the general well-being and physical health. In terms of like challenges that we're facing right now, I think that with mainstream awareness, there comes a lot of initiatives, but maybe the initiatives aren't exactly targeted at the root causes of mental wellness, and maybe there could be more support in terms of addressing the root cause.
Right. So if we looked at real intersectionality, looking at social justice issues that impact mental health or physical illnesses that impact mental health, perhaps we would see huge changes in support of people who are homeless or have food insecurity issues, financial insecurity issues, because you can't treat the symptom if you don't look at what are the underlying issues that are causing these mental health. So if we just say, oh, well, you're depressed and here's a pill, but what are you depressed about? Well, you have no food, you have no place to live, you don't have a family, you don't have friends, you're not connected in your community. All those tremendous issues that are facing people, and we're not talking about it. We didn't start talking about Black Lives Matter, anti-Black racism until George Floyd, as a mainstream sort of response.
Mm-hmm.
Isabel, progress. You seeing any progress?
I will know we're making progress when people stop freaking out when someone says they want to die. And when I say people, I really emphasize mental health staff. I'm talking about counselors, social workers, people who are supposedly trained. I'm talking about those specifically as well. Yeah.
Good point. We have a real taboo about talking about death. We have very strong cultural attitudes, and beliefs about talking about death. And it causes all kinds of issues because at all points in our lives, all of us experience some kind of, burnout or despair or hopelessness or suicidality or all those kind of, and we can't talk openly about it. We can't talk openly about so many things. And, you see that in post-secondary in North America, where we have mandated leave policies. So if a student says openly, reach out, okay, I'm feeling suicidal. Okay, well, I'm sorry, you have to leave the university. So we don't have those mandated leave policies for physical illnesses. They're developed, to be compassionate, to give you a break from dealing with university, but to get back into the university program or not to have the supports that are available through the university, like your peers, like your community, and just be sort of cut off from all of that because you have a health crisis. So I think we need to look at how we respond, how we react in a better way. Emma, any signs of progress that you see for yourself or for others?
I think as a society, mental health has become a huge topic of discussion, and I think a lot of people are realizing that everyone has mental health, not just those who have a mental illness or a mental health condition.
Mhm.
Every single one of us has mental health, just as the same as every single one of us has heart health.
Mhm.
Just depends where we are on how severe it is
Right.
or how impacted it is. So I think we've really come a little far in that sense, but I also think that when it comes to mental illness and suicide prevention and just those topics, they're coming, but
Mhm.
they're not quite as normalized as mental health,
Okay.
as in like everyone having a certain level of mental health.
And Rachel, anything about what has gone well for you?
Something that's gone well for me is just the continuous support of my friends and family, and even for myself. Like for a long time, I really didn't want to talk about, my mental health. I really didn't, because being bipolar, you tell people that and they're like, "Oh, you're crazy," and like they don't know that that's incorrect, And for a long time, I didn't talk about it, but now I'm at a place where I am comfortable talking about it, and I feel better educating someone like, hey, I'm actually not crazy. Like, you shouldn't say that. And I sit down and I explain it to them. I am having those conversations, although it may have been uncomfortable at first, but the first step is educating people, I think.
Right. So I just want to finish off today that we've just scratched the surface. There's so much to say about this. And the good news is that in 1 month, we are going to be having a day-long virtual conference. It's Saturday, October 24th. It's Hope Rising Part 2. And this is going to be Youth Voices, Youth Hope, with panel discussions and workshops and music and all kinds of things. So if you want to know more, go to our website. It's youthmentalhealth.ca, or the link right here. We also have mental wellness resources because we really believe strongly in being proactive. So putting tools for wellness into people's hands and not reacting or waiting for young people to struggle with their mental health, and then we react and, or we don't react, we do nothing. That we believe these resources, and including our new resource in this together, it's a COVID Mental Wellness Journal workbook, are the way that we can support young people of all ages, from elementary to post-secondary, all families, clinicians, mental health professionals, and educators. That is a real, concrete, tangible way that we show action in supporting young people. The other thing that we do is we have free online peer support services. So if you or anyone you know is struggling with their mental health, anyone of any age in any country can apply to ymhc.ngo/CCS for a personalized message of support from one of our peer support team members across Canada. You can also apply for a daily message of support and compassion at ymhc.ngo/EMS. That's quite a beautiful thing. Also, we have a very comprehensive database of mental health resources, crisis support services, educational resources, Indigenous resources, all across Canada and internationally. So anything that you're looking for, any kind of support is there. This is our contact information. I hope that you'll follow us on social media. We're on Facebook, Youth Mental Health Canada. We have 4 Instagram accounts, one in English, Spanish, French, and international for our multilingual infographics. We're on Twitter and also TikTok. So we hope to see you again in the future. Thank you so much for joining us, and we look forward to seeing you in the future. Thank you very much. So thank you, everyone. I'm just going to have to convert this, and I'll see you soon.